Dr. Girardin, dear Dr. Bucin, dear Beat, dear Professor Hunzinger, and also dear Professor Jean-Marie Lehn. Dear ladies and gentlemen, it's my great honor to be here again in the opening session of the very prestigious CLINAM conference. And especially this time we are celebrating 10 years, so happy birthday, CLINAM. I'm not representing the European Union. I'm here on behalf of the European Commission, and therefore also it's my pleasure to welcome you all here on behalf of the European Commission. We have many challenges in the moment to face, or we face many challenges. And many of them societal challenges, maybe also some political challenges. We had very important elections yesterday happening for Europe. But coming back to the societal challenges, one of them is really that we are an aging population, which is good from one point of view. But of course, we should be a healthy aging population. We should stay as long as possible in a good health status. But of course, this may come with costs. And of course, we will face some sickness, some illness. And the ultimate goal in the end would be we would have all our personalized medicine. But this certainly will have a big cost, but I think nanomedicine has a big potential to help here. So there is a big business potential for nanomedicine in my view. And we see also that within Europe, nanomedicine has gained a lot of momentum. And especially the European Commission, through research funding, is very committed to the exploitation of nanomedicine for, ensuring that we all can age or we can cure our diseases well. And with the European Nanocharacterization Laboratory, ENCL, which was funded by the EU Horizon 2020, we have made a big step forwards in order to have a much stronger international collaboration. And that is what we need to get forward with our results. The ENCL aims at fostering innovation by sharing knowledge between academia and industry, because it is important what we are developing in the universities, in the academia, is finding its way to the applications. So the ENCL is also important to facilitate the regulation in the European Union, because this is very important that the regulatory process is keeping pace with the scientific developments. I would also like to stress at this moment that there is a great opportunity to work even closer with the European Commission's Joint Research Centre. This is my home Directorate General. The JRC is the European in-house science service. And since July last year, we have combined all activities in the area of nanomaterials, safety assessments, detection, etc., into one directorate on health, consumers, and reference materials. And the JRC works very closely together with all of the other Directorate Generals in the European Commission in order to ensure that the policy making at least is based on sound scientific evidence. Again, I would like to stress it is important that the regulatory process keeps pace with the rapid developments in science. And last week we hosted quite a small workshop, not a big symposium as CLINAM, but a small workshop with member states, authorities, laboratories, in order to discuss, are we ready to detect nanomaterials, for example, in the consumer products, in the food chain? And the reliability of measurement results was very important, and of course the regulatory issues, because one of the outcomes was definitely the need for more coordination, networking, and dialogue. We unfortunately came to the conclusions the member states are not ready to fully implement the labeling requirements which are now asked for, and still risk assessment bodies struggle not having validated and fully harmonized procedures in hand to say these materials are safe or not. And coming to the nanomedicines, I would like to emphasize that regulators need appropriate information triggered by the nanospecific property of the drug. And this is not always covered by the standard testing regime. So, for example, if you look into the immune system, and there is much more need for harmonization of information in this respect. So we need to have, as soon as possible, suitable and ideally validated methods to evaluate new drugs based on nanotechnology. And of course, we need much more predictive, innovative methods, not just using animal testing, because they need to be suitable for in vitro tests for humans, because our immune system differs strongly between species. So we also should use more in silico tools for rapid screening. To conclude, still a lot has to be done, and a lot is there out for all of you to work on. I would like to mention in this respect that the JRC has the pleasure to open its nano laboratories very soon at the JRC Ispra site. This is in Italy at the Lago Maggiore. A call is now underway, so if there is an interest to work and to see what possibilities are there, please contact myself or my colleagues present at this workshop, or just watch our website. Now, coming to CLINAM, 10 years, congratulations. It is a great achievement. And CLINAM really has gained in the last 10 years the reputation of being worldwide one of the best places to launch novel projects and also look for better international cooperation. And as Beat yesterday evening said in his dinner speech, you know, CLINAM is the place where we can combine all of the islands, maybe working on the different topics of nanotechnology, nanomedicine. And CLINAM is the place where people come together and discuss. So it's a great summit. I think CLINAM can be considered as the really largest melting point of nanomedicine and targeted medicine. And the stakeholders come now from more than 30 countries, and this is a wonderful achievement. So, dear Beat, dear Professor Hunzinger, you have put together this Jubilee Summit, and you have put together a great program again, as also in the previous years. And this year's focus is on the enabling sciences to successful clinical applications in targeted and precision medicine and related fields. And you have chosen many hot topics, such as risk-taking versus safety, and all of the questions of the quantification of nanoparticles reaching a diseased cell. So we can expect in the next 3 days very exciting lectures and great discussions. So I wish all of us, also on behalf of the European Commission, a great summit, keeping focus the benefit of the patients, of the citizens. Thank you very much.